it. Made a couple racks, I never asked how she did it. City girls out to have fun.
Welcome to Connect with Christina, episode 10 with Dr. Michael Compton of Renew Health. Hi, Doc.
Hi, thanks for having me.
I'm glad that you're finally here. We've been putting this off for a while.
Yeah, maybe a year or so we've been talking about getting this on the books.
You're just a busy guy, so.
That's true, and you're busy yourself.
Before we get into, we have to get into a lot because there's a lot to you. But what's new with the new baby?
Yeah, well, we just had a baby last Thursday, and it's doing great so far. Well, Axel, he's sleeping through for about maybe 3-4 hours if we're real lucky, but just, fussing when he's dirty or is hungry, but otherwise he's doing really well.
Well, Pooja, you're a trooper.
She is, yeah. And Ari's so happy to be a big brother. He's excited.
He looks so cute.
Yeah.
Do they look alike from the same,
they're
like, birth pictures?
a little, becoming more similar, I think, as Axel's face sort of molds a little bit. And but yeah, they do have some similarities in their facial characteristics for sure.
So the big question is, baby number 2, that's it? Or is there baby number 3, 4?
Oh, we'll see. We'll see. No decisions yet. Too early to tell.
I'm willing to bet we're going to baby number 5.
Oh, I don't know about that.
We'll see.
I'll have to get a Sprinter van if that happens.
He's an overachiever, let me just tell you. So I think even with that, so.
We'll see. We'll see.
Okay, I know there's a lot to talk about today, so I want to dive into Renew Health and how that even got started for you.
Sure. Yeah, so Renew Health became a merger from Compton Medical Clinic, which was just me and a couple staff members doing our thing out of a small office in northwest central Phoenix area. And I merged that with Aaron Ketcher, my business partner's practice, which was Desert Medical at that time. And he and I were working together, but separate. And we were both paying for internet and phones and staff, but we were utilizing each other's staff, and there was a lot of overlap. So Aaron and I, we've been working together since about 2015. And
so it made sense.
Yeah, we just sort of said, we have duplicated overhead in certain aspects, and let's just merge this together and save a little bit of money on overhead and frustration of scheduling and logistics. And so that's really how we sort of got started. And now it's grown into, we have 7 doctors, 3 locations, a surgery center, expanding into a couple other states is on the map for this next year. And, we'll just sort of see where it takes us. But that's no plans on slowing down anytime in the near future. So it's been good.
Well, congratulations.
Thank you.
And definitely need to highlight your superstar girl in the office.
Veronica.
Name. Yes.
Yeah.
I was going to say, starting with the letter V.
Yeah, she's fantastic. I don't know what to say about her. She's always on. In this business, it doesn't stop. There's no nights. There's no weekends off. It's always go, 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 and everybody needs everything yesterday. So we do our best to try to accommodate that, and she's been really understanding of the needs of the community that we work in. So she's fantastic.
Veronica has a big heart, and I think that's, it just shows in everything that she does. So
Yeah,
little
for sure.
shout out for our girl.
Yeah.
But PI though, how did you get into PI for personal injury?
Yeah, so I moved to Arizona in 2010. And when I first started, I was actually working at this clinic over in Gilbert. I was still a student at that time. Hadn't graduated yet. I was on my externship. And
How old are you?
At that time?
Yes.
I was 25 at that time.
Okay.
And that was 2010. No, 2009, sorry. 2010, I got licensed, March 2010. And I started calling up attorneys. I worked with this personal injury practice in Minneapolis. I always thought it was a really interesting area because people had a real need for your services at that time. They were injured, they needed rehabilitation, they needed somebody to sort of grab on and sort of give them direction on what to do and how to do it and how to get over their injuries. So I just started calling attorneys, and funny enough, Dave Wattell was the very first attorney that I met with and went out to lunch with. and it was very enlightening. Dave.
He's so animated too. He's been on the show.
Yeah, I know. Yeah, it was great because Dave gave me a lot of insight and showed me that there's a lot that I don't even know that I don't know yet. And so he gave me a lot of good resources as to how to navigate the system and where to learn. And so that was fantastic. And so I grabbed onto those recommendations and just sort of kept going. So I opened an office on Gilbert and Southern, and then I was there until about 2013, and then I moved my office to Scottsdale and moved that into a multi-specialty practice, because at that time I was still practicing as a chiropractor, but I had just became an RN in 2013, so I started doing a hybrid type of situation with this multi-specialty practice, working a little bit as a chiropractor, a little bit as a nurse, and
I feel
sort of
like
morphed
ever
it.
since I've met you, you were always going to school, no matter what. Like you,
Yeah.
overachiever.
Yeah,
It's a good thing.
Yeah, it's been an evolution for sure.
But what part of PI made you say, okay, this is what I want to do?
Well, again, I think seeing these patients that really needed services and they didn't know what to do, how to get over their injury, and that was intriguing to me because they really, again, had a need for the services, and the attorneys that I was working with had a need to send their clients to somebody that understood the musculoskeletal medicine component of it, but also got it, they get the picture of what the needs are legally, what the attorney needs and how these cases can sort of morph into a whole variety of different aspects, and being able to have that communication and case management was always another level of a challenge other than just taking care of patients, which I love. But, when you have other people involved in it, it helps sort of bring it together a little bit easier, because if the patient is not fully understanding, I can reach out to the law office and explain what's going on, and they can also guide their client on what maybe they need or what they don't need, or however.
So talk more about that then. As with Renew Health, what all do you guys provide? What are all the services?
Yeah. Well, that's a lot. So we provide general musculoskeletal injury management, so just basic primary care for injuries, everything from whiplash, you fall off your house, you sprain your neck.
Or you're like the kid that they showed on the news where he was distracted. Did you see that on Instagram? The kid was walking in a convenience store and had his phone, much like us, much like me, distracted, and falls in a hole. But he was lucky because underneath that was just boxes.
Oh, wow.
I'll have to send you guys the
Yeah.
link. We're going to share the link up here because
I didn't see that.
had he not fallen on those, he would have needed you.
Yeah, for sure. But we see a lot of things. I mean, dog bites, assaults, people getting stabbed, shot, run over by vehicles intentionally. I mean, assault situations, a lot of accidents, workers, work comp related injuries. We see for just general primary care. And then we have a neurologist on our staff, so we see a lot of headaches and nerve issues, a lot of concussions. We have a neurooptometrist, and she deals a lot with brain injury rehabilitation for vision and other ocular injuries, penetrating eye injuries, glass in the eye, a lot of things of that nature for eyes. But the primary focus of our neurooptometrist, Dr. Forrest, is that she does a lot of brain rehabilitation post-concussion. And then we have Dr. Ketcher, and he's doing a lot of interventional pain management and general primary care, musculoskeletal management. Eric Seisum, who is also a CRNA that does interventional management and anesthesia for us. Dr. Forrest, she's our neurooptometrist. Dr. Ferris, she's an orthopedic surgeon that does extremities, so upper and lower extremity. And Dr. Troy Hale, he's our audiologist. He reads for our VNGs. And he's an interesting fellow. He works over at the audiology school, actually just right down the street over at AT Still. And then he's an audiologist at Barrow as well as reading with us for VNGs. We just hired a psychiatrist. He'll be starting in April.
Oh wow.
Yeah.
This coming April.
Yeah,
Okay.
interesting fellow. Former plastic surgeon turned psychiatrist. So
Wow,
he
that's a good combo, actually.
yeah,
Believe it or
I know,
not.
right? It was funny when I was speaking with him originally. He's like, a lot of plastics is dealing with people's psyche, and the transition was he just wanted to slow his lifestyle down a little bit and not have to deal with surgery any longer.
Oh,
So he
I'd
went
be
through
interested to talk to him because
another
they're-
fellowship or
yeah.
residency rather in psychiatry, and so he'll be joining our team in April. He starts so, and then let's see him. I don't think I'm missing anybody at this point.
Well, that's a deep
Yeah,
bench.
yeah.
Congratulations.
Thanks. Yeah, so it's been a ride for sure.
So going back to that doctor, I'd love to meet him because that's a very true statement. There's so much like psychology behind that.
For sure.
Plastics.
Yeah.
You know? I mean, think about people that want to get something and then it's never enough.
Yeah,
There's
botched, right?
There's more. Anyway,
yeah.
what's his name?
Yeah, Dr. Ron Renault.
Ah,
Yeah.
okay. Well, we'll bring him on the
Yeah.
show soon. TBI, it's a big thing in personal injury, but yeah, it's people don't really understand it. You
Yes.
know, the consumers for sure. How many of the people that get in accidents would you say, like percentage wise, typically have a TBI that they don't even recognize, especially when they don't live alone? They don't live with anyone.
Yeah, that's a hard question to answer, but there's about 2.8 million TBIs annually in the United States. Depends on your resource, but car accidents are a leading cause of traumatic brain injuries, and they're oftentimes misdiagnosed or underdiagnosed due to recognition of symptoms. So I can't give you exactly the data
But that is a
on that,
profound
but
like number for
Yeah.
just in general. But what can you explain a little bit more of what TBI even is?
yeah, well, traumatic brain injury, TBI, goes on a spectrum all the way from very minor brain injuries to severe brain injuries that can have lifelong consequences. The types of injuries that we're dealing with primarily in Renew Health are more on the mild end, concussive types of pathologies. And so concussion indicates that there's been a disruption in the consciousness after an event. You need a mechanism of injury to have a concussion, such as a whiplash, a fall, a strike to the head, and then there needs to be symptoms following. There does not need to be structural brain damage to have a concussion. Many times people think that if they have an MRI or a CT scan, but they have symptoms of, for example, headache or dizziness, blurred vision, confusion, that they don't have a concussion if there's no structural damage that is seen on a CT scan or an MRI. But that's not always the case. There may or may not be structural damage. So it is a clinical diagnosis, and we have to, again, take the mechanism, their symptoms, and their other medical history into context. And we do our best to try to diagnose where the problems are coming from and rehabilitate them through a variety of mechanisms.
Would you say that some, like I was saying earlier, some people that have a concussion, they don't even realize that they have it?
Yes.
So how can you, like, let's say you're doing a scheduling and you can, is there like clues you can pick up?
Yeah. We recommend that people use the Rivermead Post-Concussion Questionnaire. It's a validated questionnaire that's been around since the 70s. And that allows for people just to run down a list of symptoms and say, do you have symptoms consistent with a concussion?
Is that a questionnaire that's available to everyone?
Yeah, just put into Google Rivermead Post-Concussion Questionnaire, and it will pop up for you to review. But it's been validated multiple times over and over again. And
Is that what
it's
athletes use too? Like even high school kids?
They use a different questionnaire. They use it's called a SCAT, but there's a whole variety of questionnaires. Many of the symptoms are the same on these questionnaires, just different purposes for them. So the SCAT is used primarily in sports, but you could certainly use a SCAT, and if they have symptoms and correlating that back. But I think the biggest thing is just giving somebody a list of questions or symptoms to say, do you have these? Yes or no? And did you have anything like that before this event? And if they're like, well, yeah, I had some headaches, but they weren't like this, you can sort of start to correlate things. Some of that's a little bit difficult to coordinate, but you got to sometimes just talk to the family and see, well, was this person, are they different now? Are they short fused? Are they the same person? And sometimes we've all heard like, hey, there's just a different person after this type of injury. So we've
That's key.
yeah. And then we'll send them off to meet with neuropsychology generally in that situation to get a deeper understanding of, well, how are they different, get collateral interviews from family and friends, maybe coworkers, to see what really the story is. Because sometimes people think they're fine and they're not fine. I had this patient the other day. He came in, we did our standard process with him. He goes, he sees our neurologist, he sees Dr. Ford's for his vision concerns, does all of the testing. There's lots of abnormalities in his testing. He has a lesion that was identifiable on his brain MRI. And he comes back and he says, yeah, I feel fine. Like, I don't have any symptoms at all. And I feel completely normal. But then his wife calls me later and she's like, he's not fine. And here's what I see. He's leaving to go to work, and then he forgets literally everything that he's supposed to go to work. He's leaving our children at school. He's not picking them up. He's coming home, and it's like, where's the children? And he's forgetting very common things, and so he believes he's fine, but he's not fine.
See, that's my point. Is at least this person has a wife.
Sure.
But how about the people that are on their own?
Yeah. Well, my recommendation is to try to continuously ask those questionnaires to people and see if there's...
Yeah, we'll share that too. And honestly, this is what this is for, so we can educate people, because it happens.
Right. What I recommend doing is that you run serial, so every time you see that person is you ask them that same questionnaire again. And we keep track of those scores. And they should be consistent. And if they're all over the place, then maybe they need to get a referral to somebody else to really dig into it a little bit deeper and start maybe getting some collateral interviews from other folks.
Do you accept insurance at your Renew Health? Or
So
is that something you're working on?
No, we're not accepting any health insurance.
But you can do cash pay.
Yeah, self-pay, personal injury, and workers' comp is all we deal with. Insurance is... unfortunately,
A different beast.
A beast that we have not yet tackled, and we may or may not in the future. We'll see.
But at least you take cash.
Yeah, but if we can't help the person, or they don't want to come see us because of finances or whatever, then that's okay. We can give them resources to other folks that maybe can help them in that capacity.
There you go. And we'll put all of your information up too. Yeah. But since I personally know you have helped so many people and continue to help a lot of people with, TBI, like, I want to know, for me, so I can also learn to identify.
Sure.
What are the other things other than having short fuse, or being irritable? What else?
Yeah, headaches, dizziness, blurred vision, confusion, memory loss, or forgetfulness. I think it's more forgetfulness that they'll associate it with memory loss. Like, I forgot where I put my keys, but you knew you forgot your keys. They were just in the bathroom, not on the hook, where you normally put them. Like I said, depression, anxiety, short fuse, double vision, blurred vision, streaks in their vision, balance coordination issues.
Ooh,
are a big one. People often they may not describe dizziness, they may describe like rafting, like they're on a raft, like a river raft, or they're on an elevator or an escalator. Motion sickness are big issues, or common issues, I should say.
What is the vertigo?
So vertigo is a sense of spinning
Okay.
or motion in the environment. And there are a lot of reasons for vertigo, inner ear problems, infarctions or strokes in the brain, infection. It can come from the neck is a really common reason why we see patients that have ongoing vertigo or dizziness. And then we have to sort of match their visual environment, their perceived visual environment with what's coming in from their inner ear. and what information's coming in from their neck. So their brain has one consistent message, and their eyes aren't telling them something that's different from their inner ear or their neck. So we're in our testing process, we're able to differentiate where those things are coming from and then start matching them back up. And with those types of therapies, we're using primarily sensory motor integration set therapies and visual therapies to match all that information back up as much as we can so they have a proper orientation of their environment.
Okay. So you know who the go-to is. Dr. Compton, right?
Yeah. You know, but part of my mission with our concussion division at Renew has been to build an outpatient treatment facility that has multi-specialty integrated approach to look at these, because I'm not familiar with all the issues that can happen in vision. So we hired a vision specialist that has a fellowship in brain injury related things. And the same thing with psychiatry. So we can all collaborate, and then, you know, we'll have a better outcome. Well, at least theoretically a better outcome. But in town, there's only a few big organizations that have that. And then outpatient, there's not that many.
Earlier, I have been teasing you about being an overachiever, but I mean it in a good way. That said, I know you have other programs within Renew Health. Can you talk about those?
Yeah. So we do interventional pain management, and part of that is with regenerative medicine. So a lot of folks that we see don't want to have steroid procedures. They don't want to go through things. They're looking ultimately, if possible, to be quote unquote fixed. If that's possible, right? So certainly they want their symptoms improved, and certainly they want their function improved. So within Renew, we're able to offer standard medical interventional pain management procedures, but also regenerative medicine, which includes like platelet-rich plasma and a variety of other biologic products that can help the tissue to repair itself. So that's a nice feature. And then orthopedic surgery is I think the newest addition, and that's been great. We've been seeing a lot of patients that have had fractures and tears and things that really need to be fixed quite promptly. And you know, that's always challenging in the personal injury and workers' comp arena, because we're always trying to do the best for the patient, but balance the finances and what we can actually get for folks and whatnot. And workers' comp is really, really challenging because they like to send people to IMEs for everything. And we just do the best that you can for these folks and try to get them back in action as quickly as possible. But that's been great. And so our surgery center, we've been able to get that off the ground and moving. And we just completed our 10th case on Friday.
Congratulations.
So, thank you. So that's been great.
You have crazy machines in your
we have a lot of technology.
Tempe? Yeah, the Tempe one has what was it called?
We have it's called a Virtualis, and that particular piece of equipment is used for computerized posturography. So we use that as part of balance and dizziness assessments, and then we can rehabilitate people with that piece of technology as well. But it's much more than just that. We can do vision therapies. We can do cognitive tests and rehabilitation within that. So it has a whole variety. That piece of equipment is actually in process of being moved to our Phoenix office. But we have a VNG, and then all of our clinics actually have the same technology, so we can do rehabilitation at each location.
All the locations.
Yeah, but not every office does have the same diagnostic equipment. For example, we only have one VNG set up right now, and that's housed in our Phoenix office. And we only have one optometry set up, and that's housed in our Phoenix office. That's just because these are quite expensive pieces of equipment that. A one-time visit, if somebody lives in Gilbert or Mesa area, they'll come over to the Phoenix office for that one assessment, and then they can come back to our more convenient office to do their rehabilitation. Or if it doesn't work, For that, we'll send them to a community-based provider to have them collaborate with us on the rehabilitation aspect.
And then any weight loss programs that you have?
Yeah, we're not doing a lot of weight loss, but we do have what's called emerald laser, and we were doing a lot of weight loss, but
We've been seeing that all over
Yeah.
Instagram, by the way.
yeah, we stopped advertising it because there was a lot of confusion. Well, I felt there was a lot of confusion as to what we did. And Renew Health is a facility that deals with injuries and recovery of injuries. We happened to buy this laser because when we were originally starting, we were going to focus more on medical pain management, and part of that was weight. We wanted to have a weight program for people that couldn't go through their surgery to get their knee replacement because they were too overweight. And so we bought this laser. It's called the Emerald Laser. I believe it's still the only one in the state, but it's possible there's another one around town. And it's an FDA cleared device for total body circumference reduction and non-surgical fat removal.
So that's the part that I was saying we were seeing a lot of on Instagram. Not
Yeah.
the machine itself, but that thing.
The
you
loss,
just-
yeah. It works really, really well. Of course, you can't take away diet and exercise from that. It's
Never.
certainly
I
adjunctive,
wish.
but it does help accelerate the loss, no doubt about it.
Why? So what does the machine do?
So it opens the fat cell and causes the fat cell to contract, and it squeezes the fat right out of the cell, and then your body just passes that out. And
That's it, Veronica. I'm
Yeah.
making an appointment.
and it doesn't kill the cell like cool sculpting, lipo. Those devices kill and procedures. Lipo is a procedure, kills the cell, and this particular technology does not kill the cell. So you can regain the fat if you don't take those lifestyle recommendations into play and get. If you have thyroid disease or diabetes or whatever underlying medical conditions are maybe they're under control. So again, it's a tool, and that's all it is.
If and when people want to use it, who do they just call Renew also?
Yeah.
And then they'll
They
tell
just
them
call
the
and
cost?
make a consult appointment, and then how we do that is we'll have people do a body scan. We use an in-body scanner and have them scan so we can get an idea on what that number, the weight. You step on the scale and you see 100 and whatever pounds. What does that mean? How much is of that number is fat? How much is water? How much is muscle? How much is bone?
So you really get in there.
Yeah, because 150 pounds you may be 10% body fat at 150 pounds, or you may be 50% body fat, and it's a big difference on what we may structure for a lifestyle intervention.
Gatsby's telling me we don't have a lot of time left, but I swear I think I need you to come back here for that.
Sure.
Because there's so many people that could use your help with that. I mean, it's challenging.
Absolutely.
The way you feel about yourself affects the way you act and treat other people and your overall happiness.
Absolutely.
So
Yeah.
I would
happy
like
to
you
do
to
it.
help other people with that.
Sure.
What else you have coming up?
Well,
I know you have more projects.
yeah,
What else
outside
do you have
of Renew, my wife and I were working on opening our first assisted living center, and that should be open by June. And all goes to plan. DHS will give us the blessing to get that facility off the ground, and that will
Big
be.
congratulations.
Thanks, and that's going to be for seniors, a senior residential assisted living. And so we won't be providing medical care, but just safe housing and helping folks get their.
That's
their
definitely
care
needed.
coordinated. Absolutely.
I mean, I as you know, there's things that you hear of where people aren't treated so well.
Right.
So if you could make the difference in that area and really be make that change we're gonna get there too.
I know that's actually sort of how that came out of this. Is I was thinking. At some point in my own life, I'm going to have to either think about this for my family, myself, and
Your friends.
and your friends, and you're right. There is a lot of mistreatment of elderly folks in these facilities, and quite frankly, there's not enough of them. There's a deficiency of 2.9 million beds by 2029, according to.
And it's growing.
Yeah, it's a big area.
And like I said, I think we're going to have Dr. Compton come back because we're running out of time. However, I have some questions that some of our peers wanted me to ask him.
All right.
So let's go. Let's see here. Mary Mosquito with Move Docs. Her question is, what's one thing you wish you would have known when you began your career?
That's a good question.
Excuse me. Written on the legal plug pad, by the way. Anyway.
One thing I wish I would have known. Maybe I wish I would have spent a little bit more time with people in the beginning, learning about process, like business process. I think it would have saved me a lot of sleepless nights on just working through how to process everything from the phone call coming in to the records and bills coming out on the other side, and taking a little bit of time to spend some more in-depth time in somebody's clinic, seeing that, and then getting a contrast to multiple other organizations. I think that would have been really helpful along the way.
Okay, this one question is for me. What is your biggest failure, and what did you learn from it?
My biggest failure.
Those teaches us the biggest lessons.
My biggest failure. I don't know. I'm going to have to think about that for a minute. I might have to get back to you on that.
It could be personal, professional. Yeah, when he comes back, he's going to answer that question.
Yeah.
And last is from Kevin. What advice would you give someone wanting to pursue a career similar to what you're doing?
To find a mentor. And that's...
Mentor.
Yeah, absolutely. Again, like I said on that first question, you can accelerate your learning curve so fast by having a mentor and take you under their wing, show you their failures and successes, and learn from their mistakes. That's huge. So that would be my advice. Get with somebody that is already doing what you want to do or what you think you may want to do, and shadow them.
So surround yourself with
with people that are doing what you are trying to do or what you think you may want to do.
Yeah, that's good advice, guys. I need to thank our sponsors too, Rent Perfect. Thank you for your support. Dr. Compton, thank you for making time. I know you're busy.
Yes, thank you for having me.
That's it for this episode. Thank you for being here at Connect with Christina, a.k.a.
All right, at the Clout God.
There you go. I think that was good. It's a wrap.
Brand new biz, never asked her how she get it. Made a couple racks, I never asked her how she did it. City girls out to have fun.